As mentioned earlier, Health Minister Dr Zweli Mkhize says the army has identified the Ranch Hotel and Resort in Polokwane to be a suitable area to quarantine the 122 South Africans who will be repatriated from the Chinese city of Wuhan today. This is because of its remoteness and proximity to the airport. For more, let's cross live to our reporter, Chriselda Lewis, who is there to give us an update as to when we expect to have the plane arriving and what the events will then be after that. Chriselda, good morning to you.
Well, Leanne, you would recall last night that the Interministerial Committee had announced the location of where the more than 120 South Africans who will be evacuated from Wuhan city in China will be quarantined for 21 days. The Interministerial Committee reassuring South Africans that that evacuation process is well on track and that all those South Africans who will be returning on that SAA flight in a couple of hours now are well and are healthy. So you would know, of course, that 21 quarantine day, the 14 days, which is the incubation period, and the remainder of it, South Africa saying it wants to make 100% sure that all those South Africans are well and healthy. So the evacuation process at an advanced stage at this time, we're expecting that aircraft to land in South Africa before the weekend is over. So crucially out of last night's press briefing is the actual location of where those South Africans will be housed for those 21 days. Without wasting time, let me bring in the Health Minister, Dr Zweli Mkhize, just to chat a bit more about the evacuation process, where we are, Minister, at this stage. I know you cannot share too much with us. Good morning to you. Where exactly are we as South Africa at the moment? It's just a couple of hours now. There's so much anticipation from many quarters. Where exactly are we with the evacuation?
Well, good morning, Chriselda and all the viewers. Where we are, firstly, is to say we are on course. Everything is still going in terms of the plan. The plan was that the crew and the pilots and the crew and all the others who will be attending will fly out. They were not going to land in China. They were going to land in Manila and then spend a compulsory 24-hour rest for the pilots in terms of the international aviation regulations. For that reason, they needed to find a place where they will have the 24 hours of rest. They also have made sure they've got double crew. So the sets of pilots and crew are such that they should be easy for them to have one crew on and another crew resting, another crew on, another crew resting. So they will move they need 24 hours. And after that, they will then coordinate the times with the Wuhan authorities so that they will then move from Manila to go to Wuhan. What we have taken care of is that they should not land anywhere else in China. Not that there's a problem, but just a precaution to make sure that there's no question that there is a contamination of the aircraft, any part of China. And Chinese authorities said, look, it's safe for you not to come and park anywhere in China. So they will then move straight from Manila into Wuhan, and then that is about a 3-4 hour flight. And then from there, they will then go and wait for our people to come in. So they'll have a period of time, about 8 or so hours, to load everyone in. And then when they are done, they will then come back. So we will not be able to give you exact times because it's all got to do with them getting the slot to land in and to wait there and to get a slot to come out. And the ground logistics are also not easy because this is not a normal operation. So it means that they will have a bit of a challenge. They need to be able to take care of any challenge if someone is delayed, if the transport is not so good in Wuhan, and therefore they've got to give themselves time for that. But they've got enough time to round everybody up so that they are able to come in. And then as soon as they are done, they will then get the signal for the air slots so that they can fly out. Only then they will be moving out. So at this point, everything is on course. They do send videos. They send us messages, and we also send messages and encouraging them. We sent them a message yesterday, and one of the guys sent a message back and said, you're making us so emotional. We're really looking forward to this mission being a success. We want to come back with our fellow citizens and everything. So as far as we're concerned, everything is on course.
Minister, obviously at this point, you've overemphasized, indeed, as the South African government, that all those who are coming back on that aircraft are healthy. Walk us through very quickly, once again, about the process that's going to be followed before they even get on that aircraft, in terms of the measures that you have taken to ensure that all those that are on there meet a certain criteria.
Well, firstly, we have said that those who would have been to a hospital and were treated, were diagnosed positive, or are having symptoms, all those will not get onto the flight. They would need to meet with the Chinese health authorities so that they can get the necessary attention. And only the ones who will come in are those who have got no symptoms, have no record of having been diagnosed to be positive with coronavirus. And then when they get into the aircraft, they'll find our staff ready, kitted with our protective clothing, and then they'll meet them at the door, excuse me, and then they will then be offered gloves, masks, and they'll even be offered the protective clothes which we use for nurses. It's not necessary, but just in case people feel uncomfortable, they want to be doubly sure, then we can give them that, but it's not necessary. All that's going to be important is at least to have gloves and to have the masks. That's what we use, in high transmission areas. So that is what they will be offered. When they go inside, then all the work will be done to make sure that all the specimens and everything has been done, and so on and so on. So the only ones who will be coming in will be the ones that would have been certain that all the work has been done to ensure that they are not infected. But if anyone on board develops anything that might sound like symptoms, there's an isolation area. They will actually be taken in. There are enough medical personnel. They'll be taken to an isolation area so that they are not mixing with the rest of the other people. When they land here, anyone who's got symptoms will actually be moved to a hospital. All the others will go in. We only want people who are healthy there, because they are not sick, they don't need other attention.
Minister, finally, as government, you also announced last night the location for where these more than 120 South Africans will be quarantined for 21 days. It is here in Limpopo. You spoke about a lot of criteria that needed to be met in order for you to decide on a particular location. Talk to us very briefly about that and what you've done to ensure that if anyone does develop symptoms, even after they land here, what then happens while they are in that particular quarantine space?
Well, inside there will be health personnel who will be able to just check them on a day-to-day basis. Do they have a fever? Do they have any symptoms? And if anyone needs attention, if you come in and you you sprained your ankle, they can attend to you. But in the meantime, the major issues to look out for, signs of the infection with coronavirus. If we actually suspect, those persons will be actually moved out, and then they will be taken to a facility where they'll be treated. Otherwise, those who are in there, those who are families will be kept as family units. They'll be kept together. Those who are individuals will be kept in single rooms. We'll discourage mixing of people as a group. If you go to dining hall, you walk in, put your mask up, and then take your food, go into your room. Or if it's not possible, the food will be delivered into the room. We just need to make sure that there's not much mixing. The staff that's going to be looking after them will have protective clothes, which we use in hospitals, in isolation wards, where we make sure that someone does not get anyway infected. So they'll be able to deal with all of it that way. And people will provide some Wi-Fi so that they can tweet and they can go on Facebook and so on. So you might find that some of their stories are coming out there. We don't encourage them to be making lots of reports from there, but anyway, for family contact and friends and so on, they should be able to do that. Then they will offer TV so that they can watch TV and so on. All of those things are just to make them comfortable. Look, sitting in your room for the whole day is very uncomfortable. A lot of us, as I said, we have been through that route. It actually throws your mind out of joint. So we don't want them to have that kind of problem. It can be more of a problem than worrying about the virus actually. So especially if you know your home is so near, but you can't meet your people. So all of that we're going to be giving attention to that. So it's really to make them comfortable. The army looked at a number of issues. Well, firstly, we need an area that is not within a very large, densely populated area, so that there's no mix-up of people who walk there every day. We don't want a mix-up there. Secondly, we need a place which can have a perimeter, which can be secured by the soldiers, and then internally it also be secured by the police. That's just to make sure that nobody leaves the area, nobody gets into the area. Then we also needed to make sure that it's an area which is livable. People can sit there, they can be having a comfortable daily life. In fact, the army went through 84 spots. One of the spots was an area in Uppington. They came back and said, if it was the army, we would be ready with this. And how was this place? So it was a nice wilderness, bush, and then if it was the army, it's isolated enough, they would bring in tents, they would then put their sleeping bags and so on. And we laughed and said, well, obviously these are not soldiers, so they are not used to that kind of life. All we want is just they must just be secure for a few days, and then after that they will be gone. So we're quite comfortable. We think everything is on spot.
Yes. Everything on spot, Minister. Does it concern you, some of the dissent and unhappiness by some quarters that these South Africans will be brought here to Limpopo?
Well, we have picked up those issues, but actually it's expected that people are nervous. With disinformation, people will actually start fighting, they'll be angry and so on. And we have said anger, panic, anxiety is actually more dangerous than the virus. So we've started attending to it. You would have heard the Premier saying that they've started engagement of the leadership and the various stakeholders. We just need to explain to them, because all the leaders need to be the ones who are in the forefront to allay the fears of people, to say, if we're anxious, we're going to make too many mistakes. But if we're calculated and very scientific in our approach, we'll be able to take the necessary steps to reduce the spread of the infection. And we need everyone to cooperate. That's why we're actually emphasizing so much on information, transparency, so that people can know where we are, what their roles should be, what they should not do, what they should do. And in fact, so far, we're actually quite happy. Those who are dissenting, with these dissenting voices, some of them have already engaged and they've understood, and there are many others who still need to be convinced, and we're taking our time. But it's not serious. It's just really out of concern. If you heard that next to your home, we're going to be bringing people with a lot of infection and so on, you will revolt. But we tell them there's no such. There's a wrong information. Now, people believe anything they pick on Twitter. And people on Twitter, some of them can be very malicious. And when they're malicious, they're misinforming people and all of that. But we don't worry about that. We are actually prepared to actually defeat this fake news and so on. So people will be explained to. Primo was saying they'll be getting lots of pamphlets and meetings to tell people to say, don't worry. We've even gone to test the students who came from China. It was not necessary, but out of the concern and the fears that we've tested them, the students are negative, which vindicates us that no person from South Africa has been infected in China or from China. And secondly, that those students who have come back have come from the parts of China where the infection is not so rife. We only look after those who come from Wuhan.
Minister, thank you very much indeed for your time. The Health Minister, Dr Zweli Mkhize, just on the latest now on where the evacuation process is in Wuhan city in China. In just a couple of hours now, Leanne, we're expecting those South Africans to arrive in the country.